Good morning everyone. I am Dr. Sandeep Janardhan Tandel. I am a general and a laparoscopic surgeon. Today's topic which I have taken is another common swelling. The name of that swelling is a ganglion cyst. So what is a ganglion cyst? Why it is called ganglion cyst? Where it occurs? Which age group is more commonly affected? What are the causes for that? What are the symptoms, signs and symptoms of the patient? What are the investigations and what are the treatment? We will discuss in details. So why it is called as a ganglion cyst? Ganglion cyst, now it is a Greek word for a knot. Knot means K-N-O-T, knot, or a swelling under the skin. That's why it is called as a ganglion cyst. That's the meaning. And which age group, if you ask me, young adults are more commonly affected compared to the elderly people. In elderly people, another type of the cyst occurs which is called as a mucus cyst, that is related to the osteoarthritis of the joints. So ganglion cyst is more common in the younger population. Now the question comes, what are the causes for the formation and where it occurs more commonly? So more commonly it occurs on the wrist joint, that is the either the outer surface or the inner surface, volar or the dorsal surface of the wrist. Okay, these are the most common sites, but it can occur in other parts also. So now the reasons, one common reason which is thought is that whenever there is a frequent friction like when the wrist is used too much, movement is too much in any profession or any particular person is moving his wrist too much, that friction causes breakdown of the tissues in this area, either from the joint or from the tendon. Tendon is the part of the muscle which crossing the joint. So the breakdown of the tissues happens in this area. The tissues will get liquefies and it forms a cavity. Cavity means like you can imagine it like a balloon with containing a gel like fluid inside, and that keep on accumulating in that area, and finally it forms a bulge in that area which will be visible to you when it is significant in the size. So it can happen on the wrist part or it can happen on the inner part also. Most common joint which is affected is the scaphoid joint, scaphoid lunate joint in this area, and lower down is the scaphoid radial joint. These are the medical terms for the joint where this happens commonly, or even from the sheath of a tendon. Some thought is that it can occur because of the outpouching of the synovium. Suppose you imagine the two bones which are separate from each other. They are covered by a layer which is called as a synovium that protects the two bones to hit against each other or rub against each other. So now that layer which is covering this bone and another bone, it might outpouch, like it might come out, and that can present as a swelling over that area. Okay, so what are the symptoms of that symptoms? How patient will present to the doctor with this? Now you will notice a swelling, sudden swelling on the either the outer surface of the wrist or inner surface of the wrist, which might be like very small, maybe 1 centimeter, or it might range up to 2 to 3 centimeter also. Sometimes it might be painful, sometimes it may not be painful also. But as our wrist and hand areas are open most of the time, it becomes a cosmetic reason for the people will ask you what is the swelling you are having, and because of that also people goes to the doctor to know what is the problem. So that's how the patient will present with the swelling on that part. Sometimes patient might have pain. Sometimes if this swelling is compressing any nerve in this area, like our hand is supplied by a nerve, median nerve, ulnar nerve. So if the swelling is very close to the nerve, then that symptoms also may produce. If it is compressing the nerve, then you might have a tingling sensation or numbness, decreased sensation in the distal part of that area. If it is occurring on this part, then if it is compressing nerve, then that symptoms will produce. And other symptom will be swelling might be increasing in size. It might remain same also for long duration, depending upon how frequently you are using the wrist. Okay, so when you touch the swelling, you will feel, how will you feel the swelling? It will be little firm. Firm means swelling may not go inside completely. It will stay in that area, but you will feel it like a balloon which is filled with a lot of water or the fluid inside, which is tense. So when you see the swelling by yourself, you will see that the skin of the swelling is actually the same color as the rest of the area. When you try to move your wrist up and down, swelling might slightly move along with that movement that you can see when you are touching it as well. So when you meet a doctor, to know what is this swelling. People have a fear in the mind that this swelling might be something sinister or something dangerous which has came on the body, and they want to know. And because even the other people are noticing it, so you want to find out what is the reason and treatment for that. So the doctor will ask you how long you are seeing the swelling and what are the symptoms, like whether it is painful, you got any trauma, any injury in that part, how frequently you are using your wrist for any purpose like typing or playing, or all the different, how are your activities related to the work, that doctor will ask. And then doctor will come to a particular diagnosis in which most commonly this area, the ganglion cyst, are common. So clinically doctor will initially diagnose it as a ganglion cyst. The investigation, if you ask me, X-ray. The doctor might ask you to see the X-ray to see the underlying joints, the condition of the joint. Then even sonography can be done. Sonography to know the depth, size of the swelling, and usually these investigations are enough to confirm the diagnosis of the ganglion cyst. Now, if you ask me what is the treatment? Now, people try different treatment, watching the different videos or listening to the other people. So some people will try to rupture it by hitting a book or some hard thing. They will try to hit on it, it will rupture. Now when you hit like that, the cyst will rupture, it will break, the fluid inside will come out, and suddenly the swelling will disappear. Now you will be feeling very happy that it went out without doing anything, but it will come back again. It will recur back, because it is rupture of a cyst which will reform it again. Some people try the treatment of aspirating. Aspirating means putting a needle and taking out the fluid. Now that will also give a temporary relief. Once the fluid goes out, it will become flattened up. Some doctors try that treatment. They might do the aspiration 2 to 3 times and give a trial. If after doing that, and if the wrist movements are stopped, it might work in some people, but there is always a chance of recurrence with this treatment also. Some doctors prefer giving steroid injection, like after aspirating the fluid they might give steroid injections to stop the reformation of the cyst. That can be the one treatment, but again I will say there is still chance of recurrence with that treatment also. Now if you ask me, some definitive treatment for this condition is the surgical treatment or arthroscopic treatment also. What is surgical treatment? Surgical treatment means doctor will open the skin in that area, find the cyst, and he will try to remove the cyst completely, or ligate it. Sometimes the doctor might keep it open after removing everything and put a stitch over that area. But before that, doctor will do few investigations on, like suppose it is on the inner part of your hand, whether it is near your artery or not, like a radial artery. There is important artery which is going. If the cyst is very close to that artery, so during surgery or manipulating it, the artery should not get injured. So doctor will like to know whether there are 2 arteries which are supplying to the hand, ulnar and radial artery, whether both the arteries are patent or not. So doctor will do a test to confirm whether how is the blood supply to the hand. In case the swelling is on the inner part and it is close to the radial artery, in that condition. And even doctor will like to know whether you are having any complaints related to the nerve compression, whether you are having tingling, numbness, or decreased sensation on in the fingers, to rule out whether the nerve is being compressed by the cyst. So open technique, it's like doctor will call you it's like a daycare procedure. So doctor will call you need to get admitted for the procedure, because this will be done in operation theatre, not in the OPD basis. The anesthesia will be local anesthesia. Also sometimes doctor may block the entire hand. Entire hand means from the arm, that is a block doctor might give with the help of an anesthetist. And after that doctor will do this, as this procedure is delicate, needs some time to be performed, as there are the tendons, nerves and arteries in that area. So doctor will need the hand to be stable while performing the procedure. So doctor will open and then he will find the cyst and he will take it out, and then some stitches he will put. The another technique is the arthroscopic treatment. Arthroscopic is like it's like putting a small camera through that area and do another small incisions and put the another two instruments and take out the cyst. That's another technique. We'll say even after even after surgical treatment or arthroscopic treatment, there are some cases where patient have got a recurrence. Surgical treatment is considered much more better and definitive compared to the other treatment, but sometimes it can happen that cyst might come back in that area, because if the hand movement is too much, the friction is happening again and again, there is a chance it might come back again. So post surgery, doctor might ask you to mobilize the wrist for some days, like maybe 3 to 4 days, and then slowly he will ask you to improve the mobilization of the wrist, so that the wrist should not get stiff in that area. So that's how the treatment for the ganglion cyst is done. So whenever you get a ganglion cyst on the inner or outer part of the wrist, which is the most common area, do not get panic. Better to consult a surgeon and make sure it's a ganglion cyst before trying any treatment like hitting with a book or listening to other people and rupturing it by yourself. If it is something else which is not ganglion cyst, you may do more damage to that area. If it is near the nerve or the vessel, you might injure your nerve also along with that. So it's important you do it properly in a proper way. Hope you understood what is ganglion cyst and how it has been treated. Thank you for listening to me and my videos. Thank you very much.